as you can see, this is the research regarding the increase of the alcohol abuse in the rural American communities during the COVID-19 pandemic. This is a cross-sectional study, and this study has been done into the St. James School of Medicine, which is situated in the St. Vincent and Grenadines, West Indies. As we know, the COVID-19 pandemic in the rural American area, this pandemic has a unprecedented event in the modern global history. The rural community, they have been especially vulnerable to the COVID-19 outbreak, and studies have shown that the rural communities are more affected by the mass global events such as the recession and the pandemic. In the United States, the rural community is defined as a population area which is fewer than the 50,000 people. And when we see the alcohol abuse and the rural American during the COVID-19, so the addiction study shows that the alcohol abuse is a major issue in the rural American community. And the COVID-19 pandemic, it has been shown to amplify the rate of alcohol consumption and the subsequent alcohol abuse in the previous study. Factors such as the stress, the job uncertainty, fear, free time at the home, and restriction making the alcohol more available ultimately exacerbated the alcohol abuse. The studies also shown that one of the major contributing issues in the rural community is the lack of access to the health care. So our objective of this research to investigate the effect and prevalence of the alcohol abuse in the rural communities as a consequence of the COVID-19 pandemic. The research question has arisen like, has there been any increase in alcohol abuse cases in the rural community as a consequence of the COVID-19 pandemic? And we expect definitely increase in alcohol abuse cases in the rural community was found with the statistical significant increase of the use of alcohol during this pandemic. So we designed this method and we collected the data between the January 14 to January 14 to January 31st, 2022. Sorry for that moment. That during the COVID-19 pandemic, a survey was administered to the study alcohol abuse in the rural American communities. And adults over the age of 21 who lived in the rural American community were the target demographic. Social media such as the Facebook, Twitter, Reddit were leveraged to communicate the survey to rural American populace. A self-administered questionnaire of 10 prompts was developed based on the DSM-5 criteria for the alcohol use disorder. These are the statistical analysis and ethical consideration. So this was performed using the statistical package of social science in SPSS. Using the forward method, age and sex were included in the each steps of the logistic model. We analyzed this data with the two-tailed and the p-value, which is significant when less than 0.05 considered statistically significant. And instructed by the medical school authority, names were not recorded. Informed consent was taken from the participant while taking the online survey, and participant had to answer yes or no question to confirm their willingness to participate in the studies. The result of our study, a total number of 396 participants were eligible to participate in the final scope of our survey, and the predominant socioeconomical cross-sectional of responder was a male, which is around 68% between the ages of 21 to 29%, which shows the 34% of our data. It means the male has a more predominant factor which has consumed more alcohol during this pandemic time. Alcohol abuse level of consumption significantly increased to 6.5% during this COVID-19 compared to the pre-COVID level. And 76% of these participants said it was easier to obtain the alcohol product during the COVID-19 pandemic. 80% participants said it was harder to obtain the medical care of alcohol abuse related to the chief complaint during the COVID-19 pandemic. So I wanted to show you these data because as you can see, the liquor availability was even easier, like 70% easier, but the health facilities, even the medical care, it was very harder to get. Like 80% of the participants, they have accepted that the medical care of related the chief complaint during the COVID-19 pandemic, it was harder to get the medical care that time, but the alcohol was easier to get. That is like a government, I would say the government supply for that. And when we see this graphical data, which showing the age demographic for the cohort as related to the cross-sectional survey, it's showing what is your age demographic. So as you can see, the 21 to 29 year of age is the commonest age for these data for this research, and then 30 to 39 year, and then 40 to 49 year, and over 50 is only the small population for the research. In the gender, when you compare, the female also has consumed a lot of alcohol, but the maximum, as you can see, the maximal male, they have more consumed. I would say the male are more participated for consumption of alcohol during this research. Next, in the pre-COVID time, what was the drinking habit for these populations? So as you can see, there are like a moderate drinking over the like a more than 250%. They are like having the moderate drinking, and very small population, they are like a heavy drinking and alcohol abuse. But in the COVID-19 pandemic, as you can see, the moderate drinker are there, but you can see the heavy drinker and alcohol abuse has increased a lot when you compare. This was a pre-pandemic, pre-COVID-19 data, and this was like a ongoing COVID-19 pandemic. And as you can compare, the heavy drinker and alcohol abuse has been increased during this COVID-19 pandemic. So as you can see on this pie chart, even the ease of access to alcohol, the blue color, it's showing the ease of access. As you can see, more than 90% of the population, they are having the ease of access to the alcohol product for the cohort study, for this cross-sectional study. And when you compare about the medical care facility, this green color, this blue color again showing the medical care facility, and you can see only like it is very, very harder to get the medical care facility at that time. So you can say that the alcohol utility or alcohol, I would say the access to the alcohol or liquor, it was easier than any medical care facility during the COVID-19 time. And these were the discussion of the previous study. Overall, the rural American communities experienced an increase in a heavy and alcohol abuse level of consumption during the COVID-19 to a significant statistical conclusion. And study also shows the rural community face the greater challenges in regard to the global pandemic. Alcohol abuse, especially in the time of COVID-19, have been linked to the fear, stress, depression, boredom, influx of the stimulus capital, and lack of support in the medical care. These are our limitations of the study. This study may affect the interpretation of the data, but the survey was convenient sample recruited through the social media. Secondly, the most of the participants who accessed this survey is completed is 95%. So there may be some differences between those who completed it versus who did not completed our this research. Third, the data on the alcohol consumption are self-reported and may therefore be under or overestimated. And the fourth one, we do not know how many individuals received the survey through the social media, but opted not to participate. And the fifth, the participant geographical location were not included in the analysis, and differences in the state and the local laws regarding the COVID-19 lockdown and shutdown, it may be influencing the alcohol consumption. But despite of these limitations, these data significantly contribute to our knowledge of alcohol consumption during the COVID-19 pandemic. And we concluded based on these survey, overall cross-sectional analysis, there was an increase in the overall alcohol consumption in the rural American community during the COVID-19 pandemic. And this paper demonstrated the increase in alcohol consumption to a significant level. Looking forward, we would like to explore more demographic parameters for the alcohol consumption and determine coping mechanism during the pandemic stress, especially the role of alcohol plays in these parameters. These are my references, and thank you. And if any question, you can ask me further. Thank you.
It was a great presentation, Dr. Rajni Rathore.
Thank you so much.